My name is Becky Gross. I'm a registered nurse and a certified case manager, and I am the Chief Operations Officer for Consistent Care Services. Our Readmission Avoidance Pilot, we're calling it the RAP project, is a pilot that is aimed to address our high readmission rate. We have the worst and the highest rate here in Washington State.
What we wanted to do is to provide a better patient experience and then also to help the hospitals put together programs that would avoid readmissions.
Through the ACH, we partnered with the hospitals as well as our local Washington State University nursing program and Columbia Basin College nursing program to provide outreach by registered nurses and student nurses to address the causes for readmission.
When you're in the hospital, that means you're probably pretty sick. And the last thing you want to do is have to go back.
Folks are coming back soon, and we're actually seeing them coming back between 2 and 5 days. We will be dispatching a registered nurse right to the hospital to pull a chair up right next to that patient in the hospital room and develop that relationship and trust. Once they're discharged, we're going to make a home visit within 48 hours and do an assessment, make sure they have running water and electricity. Sometimes those basic needs go unanswered.
But then if we can go upstream and figure out what truly is triggering this readmission, then if we can solve it at that level, then it avoids the cost to the patients and it avoids having to readmit a person in a hospital that probably could have avoided that visit in the first place.
We think that it's also going to identify gaps in care, such as access to primary care timely, the availability of certain specialty care. And so once we shed light on some of those issues, then it becomes not a patient-specific issue, but a community-wide issue, a system-wide issue. If we can reduce readmissions, it's going to improve the patient's health. It's going to reduce the costs. Right now we're really focusing on Medicare because there is penalties for Medicare readmissions. So there's a financial motivator behind it. But really this is about the patients. It's about getting the patients the care that they need when they need it.
And if we can reduce that and if we can avoid the stress that it causes the patient, then everybody benefits.